Welcome to the LDN Radio Show, brought to you by the LDN Research Trust. I'm your host, Linda Elsiegood. I have an exciting lineup of guest speakers who are LDN experts in their field. We will be discussing low-dose naltrexone and its many uses in autoimmune diseases, cancers, etc. Thank you for joining us. Annie's Apothecary specialises in compounded medications. They work with the patient and their prescriber to customise a medication that meets the patient's specific needs. They are LDN experts using only the highest quality ingredients while maintaining accreditations that exceed the standard safety procedures. Call 830-981-4774 or visit anniesrx.com. Today I'm joined by pharmacist Rachel Krajewski. Have I said that okay, Rachel?
Yes.
And she's from Annie's Apothecary in... No, I can't remember where you're from. Okay, wonderful, thank you. So, Can you tell us, first of all, what made you decide to become a pharmacist?
Well, my mom is actually a pharmacist, so kind of kept it in the family and became a compounding technician back when I was in high school and fell in love with it and knew that I wanted to pursue that and become a pharmacist. So that is what I've done. Now practicing for about 3.5 years or so as a pharmacist and really, really still enjoying it.
Oh, wonderful. So let's talk about LDN. When did you, in your career, find out about LDN?
So it's probably been about a year and a half or so ago is when I found out about low-dose naltrexone. So I started a job here at Annie's Apothecary, and just through my colleagues and through them compounding it here, found out more about it. And then as we found out more about it, we started exploring it and then making it more known to our patients as well. So it's pretty much, we've been probably in the last, 6 months to a year, really getting the word out to our patients that we think that it may qualify for it.
Mm-hmm. So, first of all, can we discuss your LDN? Do you compound it in capsules, liquids, sublingual, tablets, cream? Yeah,
so we do, the most common is going to be the capsules. Mm-hmm. So that's pretty much our number one. We have done suspension forms. We've done suspension for kiddos. That's where we see some of our kiddos do suspensions, but some adults as well that don't like swallowing capsules. We've also done a sublingual form for a patient who the doctor wanted to try that form to see if it helped with absorption for her. And then we recently started doing topical. The most recent one was a topical prescription for a kiddo for autism. Mm-hmm. So that's where we see that happening more and more.
And what filler do you use in your capsules?
We use the microcrystalline cellulose for the filler.
Mm-hmm. And that seems to be the filler of choice.
Yes.
Yeah. So the patient groups that you have, you just mentioned there that you use the topical cream for a patient with autism. What would you say your patients mainly take LDN for?
I think the most common disease state that we see is the Hashimoto's. Mm-hmm. I think because of the prescribers in our region, for sure, are seeing the benefits with Hashimoto's patients and their numbers coming down as far as their antibodies. So that's probably our number one reason. Some other ones, we do have the autism. We have it for pain, patients with the fibromyalgia, pain going on. We have another patient that has juvenile rheumatoid arthritis. So kiddos doing that. And then some outliers, lupus. We have some lupus patients, and then Sjogren's syndrome as well. So we're seeing a lot of the autoimmune disorders. That's our big patient population, are those patients with autoimmune disorders.
So the people with thyroid conditions that take LDN, what advice do you give those patients? Because they can actually find that their thyroid medication is too high and they need to taper it down. Do you give any advice on that when they take LDN?
Yeah, absolutely. So we always let them know, that exact thing is that, you may see that you need to decrease that dose of your thyroid. So we tell them that they need to look out for symptoms, especially that feeling of, your heart kind of fluttering, the palpitations, the anxiety. That's the first thing that most of the patients notice. And they're going to feel that pretty fast after they take their thyroid medications if, they're seeing that the lower dosages are needed. So we definitely counsel that on them when they're starting this new naltrexone prescription.
And what dose do the patients normally start on?
Most commonly is 1.5 milligrams is what we're seeing the doctor start on. And then they'll give them a titration up, and they'll do it pretty much on a every 2-week basis, titrating up usually by 0.5 milligrams is the most common. Different doctors do different titration schedules, but we're looking at usually titrating up to that 3 milligram or 4.5 milligram dose, our majority of our physicians.
And have any of your patients reported to you any negative side effects?
So I've only had a couple, and the biggest one is going to be with the trouble sleeping, where it actually keeps them awake at night. So, the way that I handled that was just have them take a step back on their dose, because at that point they noticed the trouble sleeping when they stepped up on their dosing and got to the highest dose of the 4.5. And then when they took a step back to 4 milligrams, that was resolved. So that's kind of what we're looking at. Also even switching them to the morning, even though it's usually recommended at night, if that's just something that is, really interfering with their sleep, and we kind of make that recommendation with the physician. But, we always tell them, when we're counseling them at the very beginning, that this is something that may happen. So usually if they, after a couple weeks of their body getting used to it, those side effects go way down. Outlier side effects, I did have one lady tell me she was having muscle, kind of cramping muscle issues with her dose. So we also just brought her dose down, and that helped her and resolved those symptoms. So that was kind of an interesting one. She was using it for Lyme's disease, the low dose naltrexone.
And do you have any patients who say that they can't tolerate LDN and they stop?
I have not had any patients that have stopped due to not being able to tolerate. The only thing is if someone had to go to surgery or something, and they contacted us to see, how far they should stop. But otherwise, we haven't had any patients complain of the side effects to where they had to stop.
How many patients roughly do you have on LDN? Do you know?
Probably currently, I would say 25 to 30 patients doing the LDN.
Okay. And what advice do you give them with taking other medications alongside of LDN?
So, there's minimum, interactions with other medications. We always are going to explore if they're on any sort of opioids. That's always going to be an issue. So, exploring that. But I have not run into that because a lot of our patients are trying to find more natural ways of helping and supporting their health. So if anything, we look at kind of their supplements. A lot of them are on more supplements than prescription medications. So I haven't had to run into where someone's on an opioid prescription, but, maybe looking at alternatives like tramadol or something for those kind of patients is what we would explore doing.
Mm-hmm. And you were talking about supplements there. What supplements mainly are people taking alongside of LDN, or does it vary so greatly?
It varies. It really does. Probably the most consistent one is going to be the curcumin, just for general inflammation, because all these patients are suffering for such inflammation, and that's a very well-known supplement that a lot of physicians recommend for them. So that would probably be the most common, but otherwise it varies pretty significantly depending on the patient and their health conditions.
Mm-hmm. And from the patients that have been taking LDN, what do they tell you how they're feeling after being on LDN for a while?
Yeah, so we hear really, really good feedback from most of our patients. We have, patients that are getting really good results as far as their numbers with Hashimoto's, but not only that, but they're having a lot more energy. That's probably the biggest thing that we hear from them, or keeping their, inflammation at bay to where their whatever they may be suffering from isn't progressing. We also hear a stronger immune system, so they find that they're not getting sick as often, which is really, really awesome as well. We have, patients that really stick out that one in particular, she couldn't function in her daily life. She couldn't walk, she could barely talk, she couldn't do what she needed to do, and after being on low dose naltrexone, it completely turned her life around to where she can do all these things. She actually now works out on a farm, so
wow.
It's just a complete 360 as far as we have those outlier patients that are just completely their lives are completely turned around with it. But a lot of it is mostly, seeing that inflammation going down and helping with that energy level.
Mm. And of course, having such a cheap drug, if you're having to pay for it yourself, and the outcomes, even if LDN isn't going to work for you, the benefits it could potentially have, it's certainly worth giving it a try, isn't it?
Absolutely, and especially because, the most of the medications, the prescription medications we're looking at for a lot of these conditions have a whole slew of side effects. And, that's where we see actually a lot of our patients that come to us, they've tried multiple different things, and each one gives them a different issue. So the LDN is definitely worth a try for them, and they see that they're not having as many side effects. And it's so nice that there's something that can not only help them, but, with minimal side effects.
Mm-hmm. And the prescribers that you have in your area that you're dispensing to, are they functional medicine doctors, naturopathic doctors, MDs, DOs?
Yeah, so we actually have a nurse practitioner. That's one of them that writes for a lot of these patients with Hashimoto's within a wellness practice. So definitely. But yes, most of the physicians are going to be, we have a lot of DOs and MDs that also write for it, but a lot more in the wellness side of the physicians, doing that wellness practice.
Mm-hmm. So for the people living around your area, you would think it would be easy for people to get a prescription for LDN?
Yeah, absolutely. And, as far as it goes, if we have a patient that has, a physician that hasn't ever written for LDN, we also like to open up that door between us and the doctor. We have a pharmacist that will actually go to their office and visit with them if they're interested in, not even just LDN, but, compounding in general, but specifically, if they do have questions, concerns, they just don't know about it, we also do that for patients. We like to advocate for the patients as well. So we can let their physicians and see if it's something that they would be comfortable with writing for their patients.
And that makes such a big difference. I was speaking to a pharmacist last week, and he was saying that the doctors in his area need reassuring. They want to ask the pharmacist all the information. And he actually puts an information pack together and gives to the doctors. And he said it's really nice that when he goes to see them, he can see that it's on the side and it's actually being used, all the information. Because a lot of these doctors are seeing so many patients that they really don't have the time. So to have an experienced pharmacist on hand to do the educating is a really big deal for these doctors, isn't it?
Yes, absolutely. And, it's such a blessing for us to be able to go visit with them as well, because, they don't have necessarily all the time to gather their research. So like you said, being able to present it to them in a concise manner on their end, they appreciate it as well.
And of course, it's a win-win for the patients as well, isn't it? To find
Absolutely.
a local doctor who will prescribe it, yes. So it's Texas, isn't it, the area that you're in?
Yes, Texas. Mm-hmm.
Yeah. So how big an area do you actually dispense to?
So Bernie is a smaller town, but we're right outside of San Antonio. I actually live in San Antonio, so we span over a pretty large area. Most of our patients do live in the Bernie area, but then we have physicians that are in San Antonio as well that these Bernie patients go see. Mm-hmm. So it kind of spans, all throughout, Bernie and San Antonio.
Well, that's great. And I was just looking on your website, and I can see that you're actually a doctor, which I failed to notice earlier on. So obviously you're a doctor of pharmacy.
Yes, ma'am.
Yeah, so well done you. There must have a lot of studying going on there.
Yes, always.
But it's just always so gratifying to talk to people up and coming who have spent the time to learn about naltrexone, to help the medical profession to prescribe it with confidence, and for the patients to be able to actually go to someone face to face and ask all their questions. It's a confidence thing, isn't it? If you can go and talk to your pharmacist and it's a face to face interaction and you can ask anything of your pharmacist, don't you think?
Yes, absolutely. And it's always, so awesome, the patients, when we are able to, have the time to talk to them and see what conditions they have, what other prescriptions, what other supplements, and then still be able to say, okay, I still think this is a great option for you. They're encouraged as well, especially if they're having all these just horrible, debilitating symptoms that are affecting their quality of life, their daily activities. So it's definitely a blessing for us and a lot of hope to the patient as well.
And I would think, since it's not so time orientated like a consultation with a doctor, they probably feel less stressed, more at ease, and can probably talk to you more openly about things that they may find a little embarrassing, than they would with the doctor, because it's so hard. I've got MS, that when you want to mention there are, 9 things wrong with you, and you're trying to remember everything in the time frame, and some things, when you get home, you think, oh, but I didn't mention,
Yes,
this and this.
yes.
Well, there's not that pressure, is there, with talking to a pharmacist?
Correct. And that's what's so awesome. And, we do have consultations where they can book a time if they want to schedule it, but we also have, just walk through the door and ask for a pharmacist, and, we'll come up and talk to you. So, both settings for the patients and what they need and what's best for their comfort level.
Mm-hmm. So if the patient came to see you with a list of the medications that they were taking and the supplements they were taking, could you then advise them, depending on what condition they had and the symptoms they had, of tweaking what they were taking? Would you be able to help with that?
Yes, absolutely, and we do that probably on a daily basis, I would say. So, yes, we absolutely are willing to do that, and do it for a lot of our patients that come here.
Mm. Well, that's absolutely amazing. So you have 2 pharmacies. Would you like to tell people how they can contact you?
Yes. So you can just call us here on our phone number. It's 830-981-4774. You can email me. Probably, my direct email is rachel@anniesrx.com. Visiting our website is a great way to contact us as well, because you just enter your information or your question, and it comes directly to the pharmacist. So that's at anniesrx.com. So really, we make it easy, different avenues to contact us.
Mm. Well, it's been amazing talking to you, and thank you for taking the time to tell us about yourself and from your pharmacy as well. It's been very enlightening. Thank you.
Yes, absolutely.
Annie's Apothecary specialises in compounded medications. They work with the patient and their prescriber to customise a medication that meets the patient's specific needs. They are LDN experts using only the highest quality ingredients while maintaining accreditations that exceed the standard safety procedures. Call 830-981-4774 or visit anniesrx.com. Any questions or comments you may have, please email me, Linda, Linda, at ldnrt.org. I look forward to hearing from you. Thank you for joining us today. We really appreciated your company. Until next time, stay safe and keep well.